Presently in Africa, I think in general, um, people do wash their hands, and that's because we have an epidemic ongoing. Um, Washing their hands is something, washing it right might be where the challenge is. Um, because of COVID, we now know that, I mean, we do know everybody in the community is washing their hands. Wherever you go, um, public spaces, you will find some form of hand hygiene. I think what we now need to do is for us to do it better and to do it consistently. However, my fear is that will we still be washing our hands post this epidemic? We had this same massive attention to hand hygiene when we had the Ebola epidemic in 2014 here in Nigeria. But as soon as it was over, we all went back to our old habits, and that's not just in the community, but also in the healthcare facilities. And so what I'm looking forward to is that we sustain this momentum. And for us to do that, especially in the healthcare facilities and at the point of care, is that we have to put in place infection control programs in all our facilities. And that is predicated on political will and having a national infection prevention and control program. And I feel quite happy that COVID seems to have increased political will in a way that Ebola did not.
We're engaging multiple audience in highlighting their role in achieving effective hand hygiene action at the point of care. So we are sensitizing infection prevention and control teams, infection prevention and control committees, and health facility leaders to understand their role as key drivers in behavioral change among health workers. We're also working closely with our partners in the Orange Network to model best practices in hand hygiene as they mark the Hand Hygiene Day. Then we are asking that everybody keeps the Nigeria Center for Disease Control informed on the actions that are taken, because we'll feature all their activities on our various social media platforms. The One Nation, One Plan concept. The slogan globally for this year's Hand Hygiene Day is Seconds Save Lives, Clean Your Hands. But for the day in Nigeria, we are showcasing the strong collaboration we are building in our infection prevention and control work through our National Infection Prevention and Control Program. So we added these other themes: One Nation, One Plan, Turn Nigeria Orange. And we are pushing this message together with our strong partners. We are pushing it together with Infection Control Africa Network, Nigeria Society for Infection Control, Dr. Mayor Stella Dedevo Health Trust, the Africa Center for Disease Control, and the World Health Organization. So we are saying that as a nation, we have one plan, and everyone should take action in any way they can. Are you a healthcare worker? Now more than ever, clean your hands at the point of care. Are you an infection prevention and control practitioner? Please be a champion and mentor for clean hands at the point of care. Are you a health facility manager? Ensure that hand hygiene supplies are available at every point of care. Are you a policymaker? Invest now to ensure hand hygiene for all. Then, are you a patient? Are you a family member of a patient? Are you a patient caregiver? Help us to help you. Please clean your hands. And are you a vaccinator? Clean your hands with every vaccine. And then to every Nigerian, we are saying, make clean hands your habit. It protects us all.